Well, thank you all so much for being here today. I'm Michelle Pabis. I'm the Vice President of Government and Community Affairs for HonorHealth, and I'm thrilled to be your MC for today. Thank you for taking the time to celebrate this occasion with us, a very important milestone for both HonorHealth and UHS as we break ground on a new behavioral health hospital to better serve our community. I'm pleased to welcome you to Via Linda Behavioral Hospital. I'd like to acknowledge and thank the government, community, and business leaders in attendance today, with special thanks to the leadership from the Salt River Pima, Maricopa Indian community, and the landowners that are here today. Also, a special shout out to Healthcare Development Partners, the master developer of the entire 43-acre Sierra Bloom site where we are today. We appreciate your willingness to allow us access to lease this land and to provide a service that is much needed in our community. At the conclusion of today's event, we invite you to stay, mix and mingle, have some refreshments, take some photos, share on social media, and then we will allow also for the news media, our HonorHealth and UHS teams will be available for interviews. So without further ado, I'd like to welcome our HonorHealth CEO, Todd LaPorte, to the podium.
Wow, what a morning, huh? This is absolutely beautiful. I want to warn you that there's a bet going on. At what point do I go off script? So I won't tell you when that's going to be, but you'll have to figure it out. Thank you for taking the time to commemorate the groundbreaking of our new hospital, this Via Linda Behavioral Hospital. At HonorHealth, our mission is to improve the health and well-being of those we serve, and that improvement includes behavioral health. The needs of our patients and their families are always at the center of what we do at HonorHealth, and it is time that we be part of these services coming to our community. As I roadshow around the community and I tell them about all the things going on at HonorHealth, without a doubt, this venture is what gains the most applause, the most interest, and the most excitement. Behavioral health services addresses an important factor. Studies show Americans are faced with high levels of stress that stem from health, financial, family, and other social concerns. HonorHealth embraces its charge to be a part of the solution. As a nonprofit community health care network, we see the importance of our community in this service that has been so underdeveloped. Last week, I was at a function bringing attention to behavioral health, that the keynote speaker was Dr. Michael Crow, the president of Arizona State University. And what struck me was, and you look at Dr. Crow as such an iconic personality. You think of him as this academic elite, an amazing, innovative, and energetic person. And he shared and revealed to the crowd that he actually has 3 younger siblings who struggle with mental health issues. And his story about what had happened to his family when he was 9-year-old and his mother, who was 28 years old, was diagnosed with cervical cancer, and how their father had been whisked off, their father in the Navy was actually on an aircraft carrier at the time. And their family was whisked off to Chicago to be with family. And how he said that as he looks back, how so much of that traumatic event still lingers in their family and is intertwined with the mental health issues that his siblings are dealing with. But the real message that I came away with was that he emphasized the randomness of how these things can impact our lives, and that each and every one of us at any moment could be in need of behavioral health services, or a family member could be in need of behavioral services. So it was somewhat, I think, destiny that I was to hear his story before this groundbreaking. Some statistics are sobering. Some of them are coming up on this screen. Did you know that 1 of 5 U.S. adults experience mental illness each year? 1 in 25 U.S. adults experience a serious mental illness each year. Suicide is the second leading cause of death among people aged 10 to 34. The average delay between onset of mental illness symptoms and treatment is 11 years. Mental illness and substance abuse disorders are involved in 1 of every 8 emergency department visits. That's 12 million visits a year. So I'm proud that our new Via Linda Behavioral Health hospital facility, will help address the growing and unmet need for accessing high quality and advanced behavioral health services in the Valley and across Arizona. At HonorHealth, we feel a strong responsibility to increase access to this type of care. Our board, our leaders, our medical staff, in fact, all our staff have felt significant positive reaction to the news of our partnership to build this hospital. Inspired by the track record and leadership of Universal Health Services, HonorHealth pursued a partnership with UHS. In fact, it was really something to go full circle. On a personal note, the Senior Vice President of Corporate Development, Vic Radina from UHS, he and I go back 20 years. He was actually with Citigroup at the time and was advising Scottsdale Healthcare at the time about how to manage its bond and debt issues in the marketplace. And for 20 years, he's just been an advisor. And now we've come to this place now that we actually get to join hands as partners and our organizations. We saw it as an ideal way to leverage their specialized experience and their ability to attract talented behavioral health professionals to this community, professionals who are in high demand across the country. This facility will emphasize the collaboration of multidisciplinary teams, including psychiatrists, internal medicine physicians, certified clinical pharmacists, social workers, psychologists, therapists, and other clinical support staff and specialists. UHS is known for strong clinical outcomes and has a proven history of partnering with academic, regional networks, and community-based entities like HonorHealth. So by partnering with UHS, we're aiming to cover the gap of care so intertwined with so many other medical conditions. I'd now like to introduce my colleague, Dr. Richard Silver, former Chief Strategy Officer at HonorHealth, now a very close senior strategic advisor. He was so instrumental in developing this partnership. It's because of Dr. Silver's hard work and vision that we're here today. Rich?
Thank you, everybody. Thanks for coming today. What a beautiful day. I agree. It's really nice to be in Arizona. I'm a Philly native and was just out East Coast a few days ago, and it was freezing, so it's great to be here. So I'm an internist and geriatrician by training, and came out to Arizona in 2008. And as I got into the strategy role, one of the things that I instantly noticed is that we really didn't have much access out here for behavioral health services compared to what I was used to in Philadelphia, which is, by the way, the home of Universal Health Services. I have one of my side jobs is I get calls all the time from some of the board members and leaders and community people wanting to know how to access, who should I see for cardiology, who should I go to get my knee done, and I'm really good at that. But accessing behavioral health services is a really hard thing, and all of us may either ourselves or others have maybe had a moment where we were trying to get something for someone that we loved in an emergent or urgent situation, and it's hard. It's hard to know where to go and how to plug yourself in, and it's not very empowering to you as a loved one or whatever, or for yourself to do that. So I was asked to do, following the merger of Scottsdale Healthcare and John C. Lincoln, I was asked to do a strategic plan, and we called that Honor Vision. And in that, one of the pieces we did was to try to integrate and figure out what the vertical delivery system looked like. What kind of facilities did we have in nursing homes and rehabs and other things, and one of the areas was behavioral health. And we created a circle, and we filled the circle in depending on how good the delivery network was, and the only empty circle was behavioral health. And I mean that because every parameter we looked at, we were underserved, not just beds, but being able to access care, people with insurance trying to get into care and being told, well, it's $300, I'm out of network, you got to pay out cash. And for most of us, we can't afford that. So we sat down as a senior leadership team and under Todd's direction and said, we need to start to fill these gaps. And we've done a lot of things in a lot of different areas, but this is the one that was the biggest hole and the one that I feel the best about us starting to fill that care continuum. And UHS has been a great partner even before this, because we've partnered even with them at their Quail Run facility to try to have some telehealth services and embedded easy transfers of patients that are stuck in our hospitals. If you need medical care in Scottsdale or in North Phoenix in our geography, we can do pretty much everything short of solid organ transplants, and we can get you in and take care of you. But when you're looking for mental health services, HonorHealth as a standalone couldn't do that. And UHS, Universal Health Services, as everyone has alluded to, is a leading expert in that area, and I think can do that. So what will this facility provide? So I think the first thing that it'll provide that's really important is it's going to be a place you can go. It's not going to be an emergency room, but 24 hours a day, if you need an intake, if you need an evaluation to say, is my loved one safe, you can be brought there in person, or you can go there on the phone and get kind of a triage, like we would do in the ER, to say, are you safe to go home? Are you suicidal? Or is your care environment safe? And that's going to be really, really important. The second thing they're going to provide is inpatient care. And you can imagine that the 20-year-old who has a drug and alcohol problem, who's in crisis, something different than the mother-in-law who lives with you, who's demented and agitated and you don't know what to do, or someone in a nursing home. So they'll have floors that are dedicated to create that environment. One of the things that was very exciting to me as we looked at the cost of this thing is we try to cohabitate people in rooms of 2, which is the last thing you want as a medical patient in the hospital, but it's very therapeutic in the psych environment to have people have a roommate. And you don't need a lot of stuff. You don't need oxygen and giant expensive things. So to build a behavioral health hospital is much more economic, and it really works well. The other thing is when people leave, they have to go to a safe next level of care. And there's all kinds of words that I'll use. There's a thing called IOP, where 3 days a week you come in for 3 or 4 hours to a group session. There's something called partial hospitalization, where you sleep home and you come in every day for a full day for someone who's transitioning. And the people that run this facility, UHS will manage this facility, will be very good at transitioning those cares to the right level of care. Because putting someone in a psych facility for 3 days and saying, go ahead, you're fine now, that usually doesn't work. There's usually a lot of recovery. Meds have to be monitored. There's a lot of things that have to happen to have people be successful. So I alluded to the fact that I was a geriatrician, and I love being a geriatrician, and I love taking care of patients. But when I was in Philadelphia, I ran 3 drug and alcohol treatment centers, detoxes and rehabs. Therapeutic environments, really, really wonderful place. And I remember trying to think about, people would say, why'd you want to do that? You're a geriatrician, you have all these skills. Because it was so rewarding to take a 20-year-old and have them all of a sudden become a valuable member of society, someone that was taking care of themselves. And the life years that they pick up is decades versus, as good a job as I do as a geriatrician, people, they live a little while longer, but they don't live 50 years. I remember one case of a guy who walked out of my facility, because people don't always stay in treatment the first time. And he basically, I said, you shouldn't leave, you have a better chance of success if you stay. And he's like, I'll be fine, and literally 20 years later, I'm in the mall shopping in Philadelphia, and he comes up to me, and I don't remember him, and he says, you remember me? You told me I'd never make it, and I made it. And that does happen, but it doesn't happen. But it doesn't happen very often, and the recidivism, the failure rate of people coming out of treatment for addiction or depression is low. And the more tools, the more cards we can give them to play, the more things we can do to help them, and this is a vital part of this. Vic and I have talked, and I also know Vic a long time now, and we'd like to begin to continue to build out the care continuum. There's other pieces of this that need to be filled in, but this is our first step. And I am truly, truly excited. I'm thankful to Vic and to all the time we spent together trying to get to this point. And I mostly stayed on script, so I'm excited. Are you up next? Come on. Let me introduce Matt. Matt Peterson, president of Behavioral Health at UHS. Do you need any of this?
No, I've got mine. It shows you how important I am. As Dr. Silver had alluded to, UHS is based in Philadelphia, and I recently moved to Philadelphia from Minnesota. And I thought that the weather in Philadelphia was a lot better, but I've sort of, after being here this morning, if we've got the ability to build an extra maybe space in this facility, I think I'm willing to spend part of my time here for sure. As stated, I'm Matt Peterson. I'm an Executive Vice President at UHS and President of the Behavioral Health Division. And thanks for having us today. You know, mental health touches all of our lives. If you've not personally struggled with mental health, you probably know a family member, a friend, or a colleague who has needed services or support. UHS is known for strong clinical outcomes and a proven track record of partnering with academic medical centers, regional networks, community-based entities, and best-in-class integrated delivery systems like our partner HonorHealth. Let me bring your attention to the renderings on the monitor. I don't know if you can see it with the sun, but we utilize the latest and best practices to create treatment settings that are comfortable and pleasant while also ensuring the safety of our patients and caregivers. We maintain an individualized approach at each facility that gives us the flexibility to tailor our programs and services to meet the needs of the communities we serve. In the months ahead, we'll focus our efforts on building Via Linda Behavioral Hospital, a beautiful state-of-the-art facility here in Scottsdale. This new facility will address the growing and current unmet mental health and substance abuse needs that face the community. Studies have shown that access to a continuum of behavioral health treatment and strong community supports are a key to fostering a system of hope that can lead to recovery. Our partners at HonorHealth have been vocal and passionate advocates for better mental health care, and I could not be more pleased with partnering with HonorHealth, one that shares Universal Health Services' commitment to ensuring that high quality and compassionate care is accessible to all. With that, I'd like to introduce Vic Radina, our Senior Vice President of Corporate Development at UHS.
Hi, everyone. As Matt said, I'm Vic Radina, SVP of Corporate Development at UHS, and as Todd and Dr. Silver both referenced, go back with them a very long time. It's very exciting to be here. It really is. Helping to partner to bring these kind of resources to the community is always something that's very rewarding and very beneficial for all of us together. Today's announcement, HonorHealth, is the latest of 6 joint venture partnerships that we have led with integrated not-for-profit health care delivery systems across the United States, where we collectively look to provide focused mental health resources to the communities we serve. We are proud to bring our expertise in developing and delivering high-quality services to these communities because, as we've heard earlier, and as many of you know, they are desperately needed, and we want to deliver the best kind of quality of care that we can to make sure that the communities receive what they truly need, both in the physical health, as HonorHealth talked about, but also the mental health as well. With more than 200 behavioral health hospitals and facilities across the nation, including 4 in the Arizona market, we heard a couple references to those before. We have proven track record working with health systems to provide innovative programs and services to treat the needed population. And working with HonorHealth, our combined strength will enable us to both deliver care to not just the behavioral health, but also the physical needs of the patient, so that we really are their partner as they go down their journey of recovery. On behalf of Universal Health, I'd like to personally ask every one of you for your support as we look to provide these services and enable truly focused mental health resources in the community. As we said, we think it's essential, and we're going to need everybody's support, not just from the corporate perspective and our organization's perspective, but also from the community perspective, to make sure we really relate and can integrate to bring the necessary resources and mental health capabilities. And as always, we look forward to many years of serving the community together as partners. Thank you. Michelle?
So despite Dr. Silver's best efforts to take over my MC duties, I am home. I'm back to close us out. And really, thank you to Dr. Silver, Todd, and Matt, and Vic for your comments today. I think what's rewarding to be here is to hear the responding to community need, whether it be our community health needs assessment that showed the need for behavioral health services, whether it be our ED, which is on the front lines of folks often in crisis that are seeking services, or whether it's the conversation at the Arizona State Capitol talking about increasing behavioral health services. Kudos to our leaders from both HonorHealth and UHS for taking this on, for bringing these services to our community. We appreciate that. But now's the really fun part where we get our shovels and our shoes a little dirty. So will the HonorHealth and UHS officials please come up that are joining us for the ceremonial groundbreaking? As we do that, and again, I would encourage you to please follow HonorHealth on social media, share your photos, share your stories from today. And again, stay mixed, mingle, take some photos, meet some new friends and folks, and thank you for being here today.
Count of three, we'll go ahead and turn the dirt. 1, 2, 3.